You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hi, you guys. I am so excited about today's episode. I am going to be interviewing Dr. Katherine Shephard. I have a professional connection with Dr. Shephard, but also a personal one, and we'll touch on that just slightly. But I wanted to do an intro before we jump in and ask Dr. Shephard some specific questions when it comes to pelvic floor health. So Dr. Shephard is driven by a passion to help people through improving pelvic floor health, which she believes has been overlooked and undertreated for too long, and I happen to agree. After acquiring her BA in politics and international relations, she tried out various careers, but upon learning about physical therapy, she knew she found her true calling. Not wanting to lose any more time, she threw herself into her doctoral studies at the University of St. Catherine in St. Paul. During that time, she welcomed 2 daughters over the course of finishing her studies, which, bow to you, that's incredible. Along with treating patients and running her business, New Normal PT, she also mentors other pelvic health physical therapists and lectures at St. Catherine University in their therapy and physical therapy assistant programs. Now, with 3 littles at home, she can relate to parents and translate her care to work with their busy lives. She loves cooking, watching musicals, traveling, and sleeping through the night. Amen to that. I am so excited to have you on. I refer to Dr. Shephard a lot on a personal level as Katie, but today we will keep it professional. I just want to mention and tell Katie how much I appreciate her. I have been practicing as a birth doula for almost 7 years now. And Katie and her husband were some of the first clients who believed in me and my services. And I am so honored to tell you guys that I have been able to support her through 2 of her pregnancies and 2 of her births. And that is how we originally connected. She was in school when she had her second. And I have just been able to watch her grow and teach and educate and inform a ton of individuals, specifically moms, about pelvic floor health. And it's been such an honor to be able to bring our passions together and work together to hopefully make a difference in others' lives. So thank you so much for being here, Dr. Shephard. I'm so excited to ask you all of these questions.
I am so excited to be here. This is my first podcast. And as you said, we have a lot of connections between the 2 of us. So I'm super thrilled to be here.
Yes, it's actually quite exciting to have so many of connections, because for our client and community's sake, when we send referrals, we truly believe in who we are sending and the services that they provide and the personalities, so that our clients really feel comfortable with any referrals that we send. And so it's been really great to have you as such an important resource, not only for me, but also for our community and for our clients. So I'd love for you to tell our audience a little bit more about yourself on a personal level, but also specifically your business and your passion. And really, at the end of the day, why do you do this work?
So I mean, I think the bio covers a pretty good highlight. That's fun to listen to somebody else. I don't even remember if I wrote that or not, but like it says, I have a lot of things that I did prior in my life, and a lot of PTs, the physical therapists that I know, have more of a journey of, I was an athlete and I got injured. I went to physical therapy. I was inspired. Now I'm a physical therapist. I was an athlete, still an athlete at heart, but I did not see a physical therapist until I was already in PT school, actually.
Yeah.
So I found my path there differently. I came to physical therapy a little bit later than the traditional trajectory. Between undergrad and grad school, there was like a 6 or 7 year gap there. So I think all of my life experiences I bring to the table, and it certainly not only being a parent helps me connect with my patients who are also parents, but just all the general variety that I've done and experienced even before becoming a physical therapist, I bring to the table to be able to relate to my patients on different levels and things. My business is New Normal Physical Therapy or New Normal PT, and our focus is on anybody who has pelvic health concerns. But my two real, I would say, passion areas, especially, are postpartum people who are returning or joining exercise for the first time. So, getting back to being active, trying to navigate that field between at 6 weeks I got discharged and I'm just supposed to be able to do it all, question mark, or the
Mm-hmm.
fears that come with, is this going to hurt me further, can I do it this way, how do I find my way into movement, whether that's unloading the dishwasher, because I've had patients where that bothers them to some extent or is painful, back to I want to go back to CrossFit, and I want to do that in a way that feels safe and healthy and strong for my body, as well as um, I feel very passionate about my patients having a strong confidence in being able to make their own choices when we aren't face to face with one another.
Mm-hmm.
So that I am not their gatekeeper, I am their coach and their support and their facilitator, providing lots of information and helping them discover what feels right so they make decisions and make growth then between the times that they see me.
Mm-hmm.
And then my other passion area is treating pediatrics. So kiddos is my other, I would say, my other passion area. And I think that laces into the third part of your question. So why I do this? I think, pelvic health, um, that whole area of what we treat, whether that's incontinence or it's constipation or it's pain with intimacy, pelvic pain, pain with sitting, all of those things are so core to who we are. So
Mm-hmm.
I maybe have shoulder pain and I may just put my arm in a sling and I don't use my shoulder. I really hope that you have a bowel movement every day, if not every other day. I hope that you are voiding or going pee multiple times a day. These are things that we can stop. And if we stop, that's a real detriment to who we are as human beings, um,
Yeah.
and everything. And so they are, and yet they are having an air of secrecy or
Mm-hmm.
taboo, or I'm not sure what's normal and therefore I may not share it, or I do share it and the people around me confirm that what I'm experiencing is normal.
Mm-hmm.
Part of the name of new normal is about this idea of reclaiming your new normal.
Mm-hmm.
That phrase comes up, I think, often for people after they've given birth, like, welcome to your new normal. And I would rather that be, rather than a, well, just give up, here's the way it is,
Right.
to this is all different and it's all it looks somewhat similar or it looks somewhat different, and then re-sculpting what life is, including in your own body and with your own, these functions of exercise as well as toileting as well as intimacy with your partner or yourself, and creating a new version of that that's positive.
Well, and I love the name of your company. And the reason why is because there is so much transformation that comes when we become parents, when we become moms, when we've carried a baby, when we've birthed a baby. And I talk a lot about clients when I recommend PT, even if they don't look at their birth experience as traumatic, right? Like on a mental and emotional standpoint, there is still trauma that occurs to the body, right? Because we're carrying more weight than our pelvic floor is used to. And then when we push our baby out, there's trauma to the pelvic floor. And so, just like any other injury or surgery that we may have, usually PT is recommended, whether it be before that invasive surgery or even after. And so, I think the reason why I take so much to the name of your business is because things are different, but that doesn't mean that they're different and we have to be dissatisfied with where we're at. But it's just a new type of normal, and it's still healthy and it's still effective. And we're still doing all of the things that our body needs. Like when we check in on newborns, are they pooping? Are they peeing? Are they eating? Well, if a adult woman is not pooping and peeing, that's not normal. And so just to be able to help educate, guide them, even if their body has changed and we need to implement things that maybe we didn't have to before we birthed our babies, it's a new normal and it's still healthy and it includes all of the necessities in order to live a healthy, happy life. So I love the name of your business. I always have. I've always been a huge fan. And that kind of leads us, and we will talk a little bit more about normal versus common. That's a huge topic that I want to cover today because I think it's a huge conversation when it comes to pelvic floor health. But what do you offer your clients? Like, what are some packages? How do you kind of establish that relationship? And how do you work with your clientele?
Um, so I do offer packages. There is a 5-session package, which I think generally covers, it's a wonderful pregnancy postpartum amount. So that could be easily split as like 2 to 3 before, 2 to 3 after. I also offer a 2-hour workshop on just before delivery. So I usually do that one somewhere around week 36, 37, 38 is what I recommend.
Awesome.
And then what's great about that is I am not trying to substitute there are a lot of phenomenal, birth prep classes out there offered. My 2-hour package is more specific to what is really what you need, one-on-one, or, Stephanie, you and I have done one together, a session that was a pre-delivery. And that was really great because then the discussion that the patient and I and you all had helped carry forward that information because I can't go into the birthing space with them if it's in a hospital as a PT, but you as their doula does. And so then, I know in that instance, you were able to take notes and bring that forward as
Absolutely.
what the plan was to bring that forward. That birth went in a different direction. But that is really for taking everything that they've learned from birthing classes and saying, okay, let's tailor this to what we know about your body and your journey so far. Because in a birthing class, there are other people there and they're providing more general information, more general knowledge.
Absolutely.
And then it's on to your own shoulders to take that and interpret that for your own body and your own situation.
Yeah.
And what I'm offering is to say, bring that to me. And I will also bring to the table what I have as far as positions and knowledge and recommendations and what has worked. And let's talk one-on-one in a more personal, intimate, and specific to you space, so that then you're really prepped with what works for you. And it's great if there's a partner involved, if that person is also present. If there's a doula involved, that person could also be present for part of that. That's also extra bonus. But those are 2 specific pieces that I offer beyond just your individual sessions.
Yeah.
And then treatment with me starts with an eval, which is an hour long. And then at the end of that eval is a discussion of, okay, based on what your goals are and how we've discussed already, how we're going to go from where you are now, and we've routed a path forward towards that goal. What rate do you think you want to meet at to make that goal happen?
Yeah.
So it's always a discussion. I offer half an hour and 1 hour long follow-up treatment sessions.
Okay.
I find that commonly people feel comfortable with about the 1 week mark.
Okay.
In the beginning. It's long enough that you've given it a go of whatever you're going to try, and not so long that if it's not working, you're left kind of adrift and waiting till you come back and see me. But I also have patients for whatever reason that 2 weeks was the right time frame, or 3 or 4 weeks was the right time frame, even from the get-go.
Okay, you guys, we're going to take just a brief break so I can tell you all about an amazing company, Body Ready Method. Body Ready Method is an amazing company that offers pregnancy and postpartum programs. I urge you to take a look at this, especially if you are wanting to stay active during your pregnancy and prepare for labor and delivery. This is also a great program to help heal and recover your body post-birth. You can go to howtomom.com/links and follow the Body Ready Method link from there. Okay, back to today's episode. Well, and I love that there's such individual care because like you mentioned, we can get all of the general education while prepping our body and our mind for birth, but to be able to really specialize it to your individual body, your history, what your individual goals are, I think that's really beautiful. So it's this really individual care, but then also I love the way that we are able to partner as professionals because then this client really feels like they have a team and that we're able to try and bring their goals all the way through their process of pregnancy, birth, postpartum as a team. And so we are able to share notes, discuss with our client what their goals are so that, like you said, I can bring that into the birth space as well with that knowledge that you bring within your expertise. And so it's been a really beautiful way to help our clients feel like they have this connection within their team as well. And all that stuff, all that information is communicated. Can you tell me and I think a lot of people hopefully know this now because I do feel like we're talking a lot more about pelvic floor health today than we were 7, 8 years ago. However, for those that don't know, what are some of the common symptoms that you tend to see and treat with your patients?
So I would say, especially in the space of people who have given birth and in either a pregnancy or postpartum phase of life, that would be concerns about urinary incontinence. So leaking pee when you're not sitting on the
Mhm.
toilet, basically, anytime that isn't you chose to sit down and go to the bathroom.
Mhm.
And then a lot of, as rightly so, buzz and concern and interest into diastasis recti abdominis, which is a totally natural, happens in some research supports 100% of bodies that go to a full term pregnancy, that this distance is created between the two sides of our abdominal muscles to
Mhm.
accommodate having a baby or more in there, more than
Yeah.
one. And then afterwards, that return of those two sides toward one another can take a path such that they stay a certain gap apart from one another, and that working through how do I feel about that? Am I going to make that worse? Or how do I improve that if possible? How do I exercise with that? And all of that is very, very common in that postpartum space, especially. And then one that I don't think people come to me enough for, but I always ask about is constipation. So,
Mhm.
constipation is a piece of the puzzle for so many people, kids too, and it is just so pervasive in its impact on the rest of the symptoms.
Mhm.
So constipation can show up as an influencer in pelvic pain, in low back pain, in urinary frequency, in frequent UTIs, in not only discomfort abdominally, like tummy pain
Mhm.
or difficulty making a bowel movement, and that's uncomfortable. Like it hurts to poop kind of a thing. Those are certainly more classic presentations, or what I think people are more common with those symptoms. But there are so many other ways, like painful sex can be due to constipation. So there's
Right.
so many areas where that also comes in, and it's so common, especially immediately post delivery of either C-section or vaginally,
Right.
to have that. And so that's another piece I see and bring up, and certainly
Yeah.
emphasize with my pregnant patients, that have a plan so that
Yeah.
you can do your best to avoid that. But then here's how we go about dealing with that if it does show up.
I think it's really important too that you initiate that question just because I think sometimes people get so used to the way they have been regular or not regular for so long that that just becomes their normal when really that's not the normal that we're striving for. And so, yeah, I mean, just to even think about the body itself, like our colon is so close to all of those other organs that it does play such a huge role, like you said, in so many other areas. One conversation that was really a game changer for me when it comes to pelvic floor health is this common versus normal. And I think a lot of times, we hear moms kind of laugh and joke about, oh, yeah, you don't want to go jump on that trampoline with the kids because you're going to pee your pants. And while maybe we say those things to make other moms feel better, And we talk about it as if it is common, which it can in fact be pretty common, but is that normal? And when I had a professional tell me that just because something is common doesn't mean that it's normal, it was like an eye opener. And so I just would love to hear your take on kind of that conversation, because I feel like it's pretty common to hear people talk about that. And as a professional, as a doctor in pelvic floor therapy, what are your thoughts about around that conversation?
I think you hit the nail on the head in the sense that it is a community binding type of comment, right? Like,
Mhm.
if I have this thing that is new and you have this thing that is new to us, we are now linked in that way.
Mhm.
And in the world of parenting, despite there being so many parents in this world, it is also an incredibly isolating experience. You are the
Mhm.
only one sitting there rocking this child that you don't know how to calm, or the exasperation of sensory overload, as you and I have talked about,
Right.
and you are the only parent standing there. And so the different pieces, no matter what they are, that help give a sense of connection to another parent, or a sense of connection to this greater community as a whole, are always, connection is a wonderful thing, and is a powerful medicine, for our mental health, which therefore influences our physical health. But those symptoms in of themselves are things that, if somebody wants them to change, so often there is a way forward that changes them with,
Mhm.
and a lot of times that's with us, like with pelvic floor physical therapy and physical therapists. And so one thing I always when I'm mentoring another physical therapist, or I'm talking and teaching at St. Kate's to these new students, and I'd say, it is very important that you are listening and asking what is important to the person in front of you. So, one thing about common versus normal, I think sometimes the messaging comes across as, well, you better care about this.
Mhm.
And it isn't, a lot of these things are not, you're not going to, they're not going to cause you, endless harm if you are peeing your pants.
Right.
And so it isn't something somebody has to care about if that's not at the top of their hierarchy of needs at the
Right.
moment. But if somebody does care about it, that's when I care about it with them.
Right.
So, um, and referring to that comment to the students, just because we may assume it would bother us, we can't assume that is what is bothering somebody else the most.
Right.
But when it does bother somebody, I do hope and wish and I love that there's so many more um, opportunities for people to learn about the option for making it better, whether
Yeah.
that's different accounts on Instagram or Facebook, or conversations within the group, so that the connection piece, that where we started this, my comments on, becomes, I saw a pelvic floor physical therapist and I got better. Did you also see a pelvic floor
Right.
physical therapist and also see improvement? And now we're bonding over our experience of improving those symptoms,
Yes, I
rather
love that.
than just our experience of one more thing that is bothering us, or is
Yeah.
a burden we carry, or is a piece of the puzzle that came up when we became parents, but wasn't one that we were welcoming, but is
Right.
now part of our suffering passage that binds us. My goal is certainly that there's more that becomes the triumph piece that binds us, that we
Yes.
made it through, because it is not a small thing necessarily for some to take the time and the energy to find a pelvic floor therapist that works for them, and go through the steps of making an appointment. That's a huge accomplishment. I
Yep.
know, even just making an appointment always makes me feel so triumphant.
You can check it
And
off the
then
list, right?
yeah, right. And I know that you and I talk about helping our patients that we share make communications with each other. I
Mhm.
do that often with my patients. I'll say, okay, like, mental health is a piece that comes up
Yeah.
commonly, or a doula, or some other person that you want on your team. I might say, well, let's just take a moment together right now. Let me pull up. Everybody's got online booking so often. Let me just pull up
Yeah.
the website. Would that be helpful? Let's just take a
Yep.
moment and do that. It's not going to take very long, but somehow it's a big thing, right?
Yep.
So, I know that it is important to know the option is out there,
Yeah.
that so many of these things have uh, the possibility of getting way better, if not
Way
all the way
better.
better.
Yeah.
But I also want to respect that it takes it takes a moment to make those
Yeah.
things happen. Um, but I think if I could just move this a second in a new direction, I would say that I think I don't know what everybody's concept of pelvic floor physical therapy is,
Hmm.
but if I could speak to that, I would say that at least with my practice, and I think this is true of a great many of us, it doesn't have to be as big as you might be anticipating it is going to be.
Hmm.
So like we offer virtual appointments,
Hmm.
which I have been doing for 2 years throughout the pandemic, and they are just so much more effective than I even feared that they might be.
Right.
I have had some patients that I only ever saw
Yeah.
virtually, and they met all of their goals, and they were,
Amazing.
as far as they expressed to me,
Right.
very happy with our care.
Right.
Um, and so that eliminates the need for childcare. It eliminates the need for travel. It eliminates the need for booking out time from your job or your other activities
Right.
to accommodate that
Just
as
makes it a little
much.
bit more accessible so that we
Yeah,
actually are following through with that care.
yep, and digestible. The other thing is that it isn't necessarily 20 visits or 18, a long string of visits. I have some patients that end up seeing me just 4 or 5 times, and we've met all their
Mm.
goals and they're off doing their own thing. And um, so it doesn't have to be. I've had some patients who just come in for a checkup. They just really want to know what's happening, and that's one visit.
Right.
All is
And
ship shape. They're
understand, kind
feeling
of
okay.
understanding their body and the functions a little bit better.
Absolutely.
Hmm.
Um, And so and to that end also, it doesn't have to involve any internal work. So a
Hmm.
pelvic floor physical therapist who's had the right training certainly can assess the pelvic floor muscles, which does involve um, it truly, if we want to know what's really happening with them, it would involve internal work. But there's so much you can do without that as well. So if that were somebody's
Yeah.
concern,
Yeah.
I don't want that to be the piece that holds them back, because
Yeah.
there is a lot that can be accomplished, including possibly everything. I've
Yeah.
had patients where we never do any of that. So
Yeah. And I think that's pretty unique with what you offer, just making the resource accessible, making the resource a little bit more manageable. And of course, if there's a need for continued follow-up care or an in-person visit, obviously that's recommended and then scheduled. But just to kind of get the ball rolling, I think that seems a little less intimidating or overwhelming for a lot of families. Hey guys, it's Stephanie Sinclair, founder and owner of How to Mom. I'm just interrupting today's episode to make sure you are well aware of all that How to Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How to Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode. Awesome. Okay, that's such great information. I think this is so helpful just with your knowledge for people to know how accessible the care is. So thanks for explaining all of that. Can you just let our listeners know, just to give them an idea of what the average cost is for your services, and where is your office space where you treat your patients?
so our an eval right now is priced at it's an hour long, and that cost is $187. And then I believe, and all of the prices are on my website, and I have a hard time holding numbers in my brain. So
No, that's
um,
perfect. We can point people that way too.
yes. And I would say, as noted at the bottom of my page with my pricing, I do have a sliding scale available upon request. It isn't posted, but
Okay.
if that's what your family needs, contact us directly and we'll make sure you receive that information as far as that goes. And
Awesome.
then we have we rent a room in Edina. So it's a lovely space that is a shared workspace of multiple providers. There are other PTs, there's a life coach, there's a Pilates instructor, and
Awesome.
it's relatively new. So there's just a few of us so far, but there's room for I think 20 different providers. So we have a front desk staff person, office manager, shared waiting room with coffee and tea and a gym and all sorts of wonderful stuff. And then New Normal has its own room with a closed door and two beautiful windows. And so
Awesome.
that is all in Edina. And then virtually, of course, would be wherever
Yeah.
they are.
Yeah.
The only key for a little tiny caveat for virtual is that the patient has to be physically in Minnesota.
Okay.
Because my license is in Minnesota, I can
Yeah.
only treat patients who are in Minnesota. So
Right.
that's a little piece to that. But otherwise,
Yeah.
yeah,
That makes sense. Well, you have so much knowledge. I know that you and I could seriously sit and talk for days and days about birth and pelvic floor and all of the things. But I think
sure.
you have provided so much knowledge to our listeners today. And I think from my standpoint, when I work with clients, I recommend that they have a consult at minimum with a pelvic floor therapist just because they deserve it. And you guys are able to give them such great guidance. And it all is very specialized to them and their body and the needs that they specifically have. But what would you say to our listeners if they are still a little bit on the fence about getting the care that they deserve?
I will say that myself included, so New Normal, and then there are quite a few more. Well, quite a few more than there were
Yeah,
before the
exactly.
pandemic. There are more of us who are treating in our own practices, and in that arena, we offer free consults, usually over the phone or over video, so that somebody can have a better sense of who that provider is,
Mhm.
a better sense of whether this would be of if they believe that would be of value to them to spend their time and their money in that way, to very important resources that we have in our lives. And so that I think is fantastic. Some larger, so New Normal is very small, and these other providers I'm thinking of are either just by themselves or one or two providers.
Mhm.
And so that's part of the appeal to us as well as to our patients, going that route, is that we have the choice to give free calls. And I say I have a free 15-minute discovery call. To be honest, that's usually
Mhm.
at least half an hour.
Yeah. You
um
know, with
right.
your passion. I love it. Me too.
And
I do
yes.
interviews and they're like a full prenatal meeting, but that's okay.
Yes, exactly. Exactly. We know this stuff. We just want to,
Yeah.
we want
Get it
everybody
out
else to
there.
know it.
Mhm.
So that would be one thing I would strongly recommend. And again, we have online booking for New Normal. A lot of these other providers I know have online booking. And to book that discovery call, it can be 15 minutes. It could be much longer, but really speak to those providers, and therefore don't assume that this is going to work or not work for you. Ask some more questions and find out more strongly for yourself if that's the right decision. Larger, like Fairview, mHealth Fairview or Alina, they don't offer that as
Right.
much, but um, generally speaking, I think that's a wonderful way to better decide for yourselves. I will say this: if you are at all considering it, I would book at very minimum a post birth appointment.
Yes.
Put it on your calendar now, because
Mhm.
once that time shows up, we were already talking about the huge accomplishment it is to make
Yes.
an appointment.
Yes.
That becomes amplified in that time
Mhm.
frame, where there's
Mhm.
just so much to do, so many directions to turn your attention,
Mhm.
and sleep and emotions and all those things are tapped.
Yeah.
And so having it on your calendar, the date rolls up, 24 hours roll up, or whatever the case is, you can always reschedule it or really,
Right.
cancel it. I absolutely strongly agree with you that I think everybody has so much that could come of value from that appointment.
Yeah.
Symptoms or not. This is an area of the body that a lot of us just don't know a bunch about. And yet
Right.
that whole world just got rocked by that experience. And
Right.
so there can be a lot of
Absolutely.
peace and calm that also comes with education and knowing, even if there aren't symptoms at the moment.
Right.
And there's just so much more that can come out of that session than just
Yeah.
checking up on the muscles, which could also come from that session.
Yeah.
But I highly recommend that even if it's not during pregnancy, book one for yourself postpartum.
Yeah.
So, or have somebody else book it for you. People can certainly buy, especially from practices like myself who are out of network or cash based. You could buy, somebody else could buy that session for you. That
Yeah.
could be a great
Yeah.
baby
Put
shower
it on
gift.
your registry.
Exactly. And say, I
Mhm.
would like at least one session.
Yeah.
And part of the gift could be they book it for you. But
Right. Because we
um,
don't need any more
yeah,
onesies or any more outfits. We are finally to a point in our society where we're talking about the things that we actually need during postpartum that will aid in our recovery. And um, I think my suggestion and what I talk to a lot of our clients about is book that discovery call while you're still pregnant. Establish care with Dr. Shephard. There might be things that you can work on that you don't know about yet. But if nothing else, you've established that care so that when you visit her postpartum, you already know her face, you're familiar with her practice. And I suggest that all of our clients see a pelvic floor therapist after they birth their babies. I had one client who had a 3rd-degree tear, and she said, "Are you recommending that I do it because of my tear, or would you recommend it regardless?" And I said, regardless, but especially with a 3rd-degree tear. So I am just amazed every time we talk. I always learn so much. You have so much knowledge. You make this care really accessible. It doesn't feel overwhelming. And I just appreciate what you do and the difference that you're making. And so thanks for sharing all of your knowledge with our listeners today. Can you let them know where they can find you?
they can find me on the interwebs, right? So
I love it.
the New Normal website is newnormalpt.com.
Okay.
I also own, and you would be directed to the same site if you put in newnormalphysicaltherapy.com.
Okay.
Either same website, same location. I am on Instagram, and therefore my posts also share to Facebook, and that is New Normal PT is my handle on Instagram, and that's my Facebook. I don't know what that's called actually.
Page.
Page,
That's
yeah,
okay. I know
is
it's all
New
a
Normal
lot.
PT.
Yeah.
Yeah, you're right.
Well, we will have all direct
Yeah.
links below in our notes of this podcast. But Dr. Shephard, thank you again for joining us today. I know that a lot of listeners are leaving with a ton more education, and we hope that you get the care that you deserve. So thanks for being on today.
Thank you so much for having me.
All right. Have a good day, everyone. All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.